Well, let me now welcome on board Sandhya J, Group CFO at Narayana Healthcare, joining in on the show right now. Sandhya, great to have you on ET now. Your stock, Sandhya, has performed, quite meaningfully all through this year. What, according to you, have been the fundamental drivers behind this kind of performance?
Typically for healthcare is a robust quarter. Normally, we see high revenue flow through, throughput flow through in Q2. And as we had done a lot of work over the past several quarters in terms of improving our efficiency through use of technology, through improved throughput, through use of um, say new age techniques like robotic surgeries, etc. So all of it has kind of culminated and added up to see the kind of results that we have seen in Q2.
And margins have expanded sharply, especially in India operations. Can investors assume this margin profile is now the new normal? Were there tailwinds that may not repeat?
I don't think there were tailwinds that may not repeat again, but there are continuous headwinds that the industry keeps facing. So to that extent, I don't want to give a forward guidance on whether the margins are normalized. But what I can definitely say is that for that revenue throughput that we achieved, the cost base that we have achieved, we can sustain subject to any headwinds that may come depending on how, there are various, like for example, the new labor law has got passed. We are still assessing the impact of that. There are cost headwinds that keep coming in the healthcare sector. Currency is a big factor because a lot of our equipments are imported. So there are many headwinds that come, but I would definitely say that the cost base for Q2 is normalized.
Right. Sandhya, a big part of the earnings flow through is coming in from better case mix and payer mix as well, right? Rather than high volume growth. How sustainable is that lever, say, over the next 4 to 6 quarters?
Yes, you are correct. A lot of the flow through has come from better payer mix. Now, there are two parts to the payer mix. One is that we've been working in terms of improving the profile of the payers, and at the same time, we are also holding on to ensuring that we make healthcare accessible to all payers. So we have been playing that balance. So therefore, whether there would be a sharp increase in the payer mix from here or improvement, I don't think so. So to what we have reached is a steady state, and we will make incremental changes from here to the extent we can. As far as the case mix is concerned, there is definitely much more headspace. We are now doing the largest number of cardiac robotic surgeries in the country. And likewise, on many of the high-end procedures, our volumes have gone up, and there is definitely more headspace to keep improving on the case mix. And in terms of just revenue throughput, I think the factor that we are able to achieve, which has worked for us, is that within the same facility, so we've not added any bed or any capacity in the past 5+ years. So within the same capacity, we are able to process more volumes. I think that's really what is giving us that throughput advantage. And there we still have more headspace. We can keep pushing through more volumes through our existing facilities.
And Cayman has been a big value driver, right? Given the ramp up is now in some form or shape plateauing in terms of hospital revenues, is the focus shifting to insurance? Can you give us a glimpse on that?
So more than the focus shifting to insurance in Cayman is an additional model by which we are trying to ensure that we are able to make healthcare, holistic healthcare offerings like the way we are doing in India as well. Cayman as a country is a small country, and there is a certain potential of that country, and I think we are reasonably present to the potential that the country has to offer. Insurance allows us to enable a more effective way of delivering the healthcare services, and therefore we are pursuing it. So both are important for us. There is no focus shifting per se, but we will push both levers like we are pushing in India.
Right, understood. Sandhya, you're also entering a heavy capex cycle, right, over FY 26 to 30. Can you give us as to how this will help you scale further, and how do you reassure investors that free cash flows and balance sheet strength won't be compromised?
If you look at our capex plan, they are largely being debt funded, and we've also been able to create very meaningful project finance arrangements with the banks. For example, we've got a very long-term infrastructure funding from banks between 15 to 25 years for our new projects. So that allow us to phase out the cash flows aligned to the turnaround of the respective projects itself. And we also very closely monitor our overall ratios, and the way we are seeing them right now, we do believe that we will stay within our internal thresholds that we've set ourselves in terms of leverage ratios, as well as in terms of our ability to repay for our borrowings. So we don't see at the moment, obviously it is stretched in terms of versus what we have done in the past. We have taken a huge stretch, but we do think that our balance sheet has the strength to accommodate.
With several new hospitals planned, does average revenue per operating bed usually dilute in early years, which is typically how the industry would work? How should investors think about your RPOB trajectory, especially during the upcoming Capex cycle?
Firstly, I think RPOB, we have always said, is not the right measure. The right measure is average revenue per patient. Uh, but keeping that aside, whether it is RPOB or average revenue per patient, it is driven by the market in which we are operating. So therefore, certain markets have a slightly higher RPOB and certain markets have a lower RPOB. So one of the factors that will determine our realization profile will be where we are able to operate. The second factor which will determine is the type of surgeries or type of facilities we are able to provide. So, for example, some of the large hospitals that we are going to set up, we are going to do a lot of advanced work. The other hospitals which we are setting up will be super specialties, but they will not be doing the kind of very high-end advanced work which our large hospitals flagships do. So, to that extent, that also impacts the RPOP. For your specific question, will we have to discount price in order to be able to fill up capacity? We don't think so, because we do believe that these prices are determined based on a cost factor. There is a certain cost of service that need to be recovered. So I do believe that our pricing is we are anyway an affordable segment player, and we manage our pricing very tightly to ensure that it is affordable for our customers, and therefore I don't think there will be huge pricing pressure in the initial years. Volumes, yes, we'll have to pick up volumes over time.
Right. Sandhya, so good having you on the show today. Thank you for your time. Okay.